The Trump administration is rescinding a Biden-era policy that required hospitals to provide emergency abortions to women whose health is in peril, regardless of state law. The guidance was issued to hospitals in 2022, weeks after the Supreme Court overturned Roe v. Wade in an effort to preserve abortion access for extreme cases. The Biden administration argued that hospitals needed to provide emergency abortions under the Emergency Medical Treatment and Active Labor Act. That law requires emergency rooms that receive federal funding to stabilize all patients, regardless of their ability to pay. It does not specifically include abortion, but administrations going back to President George W. Bush have interpreted it that way. In a letter rescinding the guidance, the Trump administration said hospitals would still be subject to the law requiring them to provide reproductive health care in emergency situations, but it did not explain exactly what that meant. Some doctors and abortion rights activists say this adds to the growing confusion around emergency care and abortions and could mean women will not get emergency abortions in states with strict bans. And Claire McCaskill, I'd love for you to chime in. I'm, continuing to be horrified that the American people, in electing Donald Trump and continuing with these bans, are messing around and finding out because an emergency, a reproductive emergency doesn't just happen to Democrats. It happens to Republicans. It happens to all women. And oftentimes they need abortion health care to save their lives or to save their fertility.
Yeah. My daughter desperately wanted a child, and we were on a trip in California, and I spent hours in an emergency room with her because she miscarried. And they gave her the health care that she needed to have at that moment. Women don't go to emergency rooms to get elective abortions. That's not where they go. They would be turned away at emergency rooms if they were getting an elective abortion. The only reason women go to emergency rooms because it is an emergency. They are bleeding. They are in danger. Their health is jeopardized. And to say this guy, for him to send out a letter, I'm sure at the urging of those people who want to make sure women have no health care choices when it comes to their reproductive health, and not even fully explain the difference between emergency reproductive health care and an emergency abortion. I don't understand the difference. It's a distinction without a difference. So, I think this topic, Mika, has kind of, taken a back seat because of all the nonsense of Trump over the last 6 months. It's time for us to begin to sound the alarm again. And this letter is a good place to do it because women are going to die because of this letter. It will happen. They will bleed out in parking lots because of this letter.
Well, this is another post-Dobbs protection being pulled away because the basis of this is EMTALA, which, Mika, you explained at the beginning of the show. But that's basically a law from the 1980s that says you have to provide emergency care broadly, regardless of someone's insurance status. That's to make sure that providers and hospitals are giving people what they need when they show up in the emergency room. Then in 2022, the Biden administration's HHS added the provision that in response to Texas's restrictive laws, EMTALA had to provide for abortion and reproductive health care because of the concern that Claire is talking about here, that women were basically being told, because providers were either fearful or they appreciated the ideology of the day that Republicans who restrict abortion health care share, that they were worried about what would happen to them if they provided this kind of health care, if the woman had other choices. Effectively, we were hearing stories from the ground through reproductive health care groups and others that women were basically being told, you have to get sicker in order for us to feel that the only option is to do a DNC, is to do something in the abortion health care realm. And so this is yet another protection being ripped away here. And I think you're right. It's faded from the national consciousness, but the results and the impact of these kinds of restrictions are still very much being felt. I would add, as someone who's covered the reproductive landscape for a while now, The fear after Dobbs was that you ended up with a patchwork of rules across the country, where in some states you had options, in some states you did not. This only exacerbates that. For example, Colorado has a rule on the books that independently enforces EMTALA, but other states do not. And so once again, women don't really know where they can go for health care options that they very much deserve.
Yeah, it's beyond me why health care for women has to just roll backwards to the dark ages. I mean, this is literally crazy, and we're finding out the hard way just how bad it's going to get for women because of Republicans and because of this letter and because, of course, the fall of Roe. And Claire, I'm so sorry for your daughter's loss. Thank you for sharing the story. And it's a story that's repeating itself across the country for many women, especially in states with strict bans, who need help, who need life-saving health care. And we'll continue to follow it here. Well, it won't take a backseat here. Go ahead.
I got to jump in and say she got great care and was pregnant again within the year. And baby Rose was 9 months old this week, and she's amazing.
I'm so glad. I'm so glad. Claire McCaskill, thank you very much for coming on this morning and sharing. Willie.